Hello everyone, hope you're well today. So I just wanted to make this little video for a few of my clients and patients that I have noticed have been complaining a little bit more frequently about sciatic nerve pain. So sciatic nerve pain is typically pain that may stem from the lower back or somewhere along that sciatic nerve pathway. So I'll just have a little chat about the anatomy of that sciatic nerve to start off with. Your sciatic nerve branches off from your lower back, your lumbar spine, from the spinal cord. Those nerve roots that exit join together to form one big long nerve that travels down through the glutes. And then from the back of the hamstring, we're getting branches off that nerve that go around and supply different areas of the leg with sensation and motor control. So this can present in either a achy pain, sometimes a burning pain, sometimes a shooting pain down that nerve pathway. And it's typically from the lower back, maybe from the glute, down the hamstring, and then it can go anywhere past the knee, around the front of the leg, back of the leg, into the foot as well. So there are a few different causes of our sciatic nerve pain. So if you think about that long pathway that we have there, we can have from the very top of that sciatic nerve exiting the spine, we can have a disc injury, which I'm sure a lot of you have been spoken to about before. Statistically speaking, the majority of the population will have sustained some kind of injury to their discs, particularly in their lower back, some kind of degeneration, some kind of disc bulge, and it's just by the age of 26 years old. So by your mid-20s, most of us will have had a disc injury. The reason some of us may have sustained that kind of trauma or injury to the spine or wear and tear and just don't get pain is because the spinal column is a round structure, and at the back of the spine is where your spinal cord and nerve roots exit. So if you think about that, your spinal cord is like that. Your discs are also like that in between each vertebral body. And with that little gelatinous tissue, it can pop out towards the back and then touch a nerve, irritate a nerve, or it can pop out anywhere around the front, and there's not really much structurally that will cause any pain in that area. So it's just completely luck of the draw, dependent on often mechanism of injury or just the directional force that have gone through the spine that have caused that disc to pop out and affect the nerve pathway. So, and also some other contributing factors of any of that sciatic pain or symptoms that you're experiencing. The sciatic nerve is very closely related to the glute muscles. It runs straight through that area, and there is a muscle called piriformis, which it's very closely related to. That's an external rotator of the hip. And this muscle, you can get a lot of trigger points, a lot of tightness, and depending on the person, there's usually 3 different pathways that the nerve takes in regards to that specific muscle. So it may go straight over the top of that muscle, underneath that muscle, and in 30% of cases it pierces straight through that muscle. So if you've got a lot of tightness in your glute muscle, that can also contribute to irritation of that neural pathway. And then if you think along the way down, there's a lot of connective tissue, a lot of muscle that can also cause some irritation through the nerve. So we can get multiple factors and multiple areas of tightness or tissue disruption along that nerve pathway. So I am going to do a little video on just some gentle exercises to help self-manage if you're feeling like this is something that does creep up on you a little bit and you don't really know what sort of things you can do to relieve the pain yourself. These are exercises I often give patients when they're experiencing this sort of thing. And I hope it's helpful. Just on a side note, in terms of any numbness, tingling, Any serious numbness or tingling, any significant weakness that you're feeling in the leg, or any, particularly a red flag is any change in relation to this pain, any change in bowel or bladder function, so any incontinence issues, you definitely don't want to muck around with that, and you want to go straight to the doctors or to emergency to get that checked out and let them know that you're feeling those symptoms, and they'll get you through for a scan straight away. That's nothing to muck about with. Okay, so to start off with, usually people that are experiencing a big flare-up of sciatic pain, they've done something, you know, they've been in an awkward posture, maybe in the garden for a long period of time, been on a long drive, something like that, that's flared it up. Usually it's some kind of sitting posture that will flare it up, or some awkward posture for a long period, or maybe you've just slept a little bit funny. So sometimes we're getting this really tight inflammatory seizing up and spasm of your lower back muscles. So just do a couple of little exercises, very gentle, to just try and ease those muscles up. If you're feeling that it's an acute flare-up that you're experiencing, this is a great place to start. If you're feeling like you're not too bad, but you just want to try and see if these exercises help any kind of dull, kind of nerve achy pain, then you can skip through this part to the next section. So we'll just start off with lying on our back. So I've just got my mat here. So anyone that I talk to that has lower back issues, that finds it really hard getting up in the morning, or really hard putting on your socks, if you think about what I was talking about, how the nerves exit the posterior part of your back, whenever you bend forwards and those joints kind of space out, the disc, if it's popping out towards the back of the nerves, it pops out a little bit further when you bend forwards. That's why flexion is usually something we avoid if we do have that disc injury there. So to start off with, we're just going to bring our heels towards your bottom there. This is something you can do first thing in the morning when you're in bed. So before you get up, before you add compression forces and gravity through the spine. So all I'm going to do here is have a little rock of my knees side to side, just really small. So depending how tight you are, depending how sore you are, you'll only be able to start small, and then as you feel the body accepting the movement and easing into the movement, just increase that movement slightly. And if you're feeling not too bad here, you can go into those bigger rocks of the knees, maybe all the way down to the ground if you're a little bit more bendy through there. Okay? So, and this is just warming up, bringing all the blood supply to the area, nerve supply waking up, and also improving your joint lubrication before you then sit up and add those gravitational forces through the spine. Okay? All right. And usually coming onto the side, if you're sore, pushing yourself up out of bed like that. Okay? Now, from here, if you need to feel like you need to have a little bit more of a stretch whilst you're upright, you can do that as well. So just a little bit of rotation. You can be sitting on the edge of the bed, just a little bit of gentle, nothing to end range here really. If you're feeling quite stressed and strained through the back, we don't want to really push into too much stretch through that lower back. We just want to encourage a little bit of movement and let your body know that it is safe to still get that movement going there, as long as we're not over stressing and straining. Now, for our nerve type pain from the lower back, our disc type injury, typically a therapist like myself or physio, chiro would give you what's called the Mackenzie type exercises for that disc injury. So they're pretty reliable. I've had a lot of success with these with patients before, as long as they've got sort of, only up to a mild disc injury and no serious nerve compression. This does tend to help. So we are just going to have a little lie on our stomach here. Okay. Now, for some people, even just lying on the stomach may be a little bit too much for the body if the pain is really acute. So you may want to grab a cushion, have that down there first, and then lie down on top. And so all we're doing here is sitting here, lying here for 1 to 2 minutes. And this is just aiming to try and allow that disc to settle back gravitationally. So that little prolapse, that little bulge that's coming out, it's just encouraging it to go back towards the center of its nucleus, of its center of its tissue. So your typical timeline for a disc injury in terms of pathophysiology and your prognosis of it dehydrating. So the tissue doesn't just stay like that forever. It does dehydrate and usually kind of shrink back into its normal place and heal. So your typical timeline is usually between 4 to 6 months if all is going well and you're not re-aggravating the mechanism of injury and re-aggravating that disc and putting too much load through that area of the spine. Okay, so been here for a little bit now. Now all we're going to do is bring your elbows into your side and we're just lifting up into a little bit of extension. See how I'm bending, curving through that lower back now. So usually a disc injury that is popping out towards the back, towards those nerves, it will be a flexion or rotation type injury. So by doing this extension, we're just encouraging the spine to move in the opposite direction, nothing forceful. And I would just hold here again for another 60 seconds, as long as the body is not severely reacting to this. And even if you just want to start with a tiny bit of extension and then lift up gradually. And if this is feeling okay here, then we're going to move up a little bit higher and hold there. And just breathing nice and relaxed in those shoulders. So you shouldn't be straining too much here, just bridging up on those elbows. And then if we're feeling okay from here, and you're okay too through the arms and shoulders, you can push up into a deeper extension there. And as long as that's not causing any pinching or sharp pain, you should be okay with that one there. And just go within what your normal range is. So what's normal for me is going to be completely different to what's normal for you. Everybody is made differently. Everybody has different strengths, abilities, different ranges of motion available to them. So it's not a competition. It's just whatever's feeling right for you today. All right, lowering down. Okay, from here, I'm coming back down all the way. Now, if your pain is, so this is my left side, so I'm going to show you on the left, depending on what side it is. Another way of assisting that nerve to kind of release and that area to kind of release through the back is to bring your knee out wide to the side. Now that creates a little bit of side bending into that area of the spine, the left side, where that disc may potentially be popping out of. And again, you just want to hold here for 60 to 90 seconds. And just breathe. And then from here, again, I'm just going to come up into that little extension. So we're combining those two movements. Now just be intuitive with your movement. So just go with the feel. If it feels okay and safe, and you might get a slight discomfort but nothing major, then you're probably all right there. But if there's any sharp shooting pain, if it's creating any tingling, anything like that, then just back off out of that exercise. It's probably not for you today. Great. Bit of sitting and waiting around for this one. Couple more breaths there. Big breath in and release. One more there. Big breath in through the nose and out through the mouth. Okay. And then lowering back down, slowly bringing that leg through center. If you had that cushion underneath you, you can just slide that on out. See if that's released anything, and if you're a bit better lying flat on the ground, if you did have that cushion propping your pelvis up. And then when you're ready, bringing that knee into the side, rolling yourself onto the side, and slowly coming back up to seated. Okay, when you're having any struggles through the low back, that little push up from the side is your easiest way of getting out of bed rather than trying to flex up this way or trying to push off into too much extension. All right, from here, I'm going to show you a nerve pathway release. So we're going to use a chair. Okay, so from here, sitting up nice and tall. All right, so we're going to go with my right side, is my side that I'm getting my nerve pain on. So some of you might want to sit up a little bit higher on a chair so that you can kind of dangle that leg off a little bit. And from here, I'm just going to straighten that leg out, sitting a little bit further forwards. I'm going to straighten that leg out and pull that to my face. And if any of that is causing that kind of nervous pain, we're putting that nerve on stretch a little bit there. And then if we slump forwards, then that's a positive test for any part of that nerve pathway, from slumping forwards to flexing the foot towards the face. So we can safely say there's some issue along that nerve pathway if that stretch through the nerve recreates your symptoms. Now, I want you to be careful with this. If you slump too far into it and drop the head, it might create a really nasty nerve stretch, and we don't want to really try and overstress the nerve if it's already irritated. So from here, what we're going to do is hold, if you have the ability to, hold your leg out like so, and flex the foot towards the face. Now, I'm keeping my body nice and upright. If there's anything going on in that disc, you probably want to avoid that slump, because that's really going to have that little bulge pressing on the nerve there. So just sitting up nice and tall, keeping that part neutral, and we'll just work that pathway through the leg and the rest of the spinal cord. So what we're going to do from here is have the straight knee, and then bend the knee in, point the toe behind you, flex the head down. Straighten the knee, flex the foot, look upright. Bend that leg in, looking down. Straighten and look up. Bend and down. And again, just about 60 seconds of this will do the job. So if you have a chair that's a little bit higher, maybe a bar stool, that might be a little bit better for this one, just so my long legs are skimming the floor here. And now you're aiming for that opposition. So as the foot lifts, the head lifts. As the foot points down, the head points down. And that's what we're aiming for. Not too much stress through the nerve, because we've got that bend through the hip, we've got the bend through the knee happening. And basically what that is doing, so if you think that nerve root exits the spine, comes all the way down here, your spinal cord also attaches all the way to the brainstem. So what we're doing here, by creating this tension at either end of your nerve, it's called flossing. So we're flossing that whole neural pathway through all of its pathway, through all the little areas of fascia, connective tissue, muscle that it might sort of be stuck or gripping a little bit. So it's just ensuring that that nerve has that nice little pathway to slide and glide through the whole body. So that's just a nice gentle one, shouldn't be too intense. And now I'm just going to progress that a little bit. So on the couch here, This is only if you've got enough flexibility through the hamstring, and then if this sitting like this, sitting with your legs straight, is not bothering you at all. So what I'm going to do from here, leg is nice and straight, so you can do this again on the edge of a bed on something a bit higher, that's fine. As long as the side that's affected, that leg is relatively straight. If you need to, you can have a little soft bend of that knee if that hamstring is really pinging, trying to sit up tall there. Some of us just don't have that flexibility in the hamstring to have that leg extended and keep nice and tall with the back. We'd have to slump so that we can get that leg straight. So just be mindful of that. We're all very different. And then from there, with the knee straight this time, that'll put a little bit more stretch on the nerve. And then we're just pointing the toe, flexing the head, bringing the foot to the face, looking up. Pointing the toe, toes to face and look up. Point the toe away, drop the head. So it's a little bit of brain training, a little bit of coordination. And if you don't have any issues with that little slump through the lower back, you can come into that tiny little roundness through the spine. But if you're finding that that back movement is really irritating, just try and keep your spine nice and neutral. It will still get the same effect because we're still putting tension from one end of the nerve pathway to the other. It just means that that's probably a more sticking point for you. Alrighty. Okay. Now, so what I was saying before about your piriformis, that little muscle in the hip, it attaches from your greater trochanter of the hip all the way across to the sacrum, and its movement is to externally rotate the hip there. So if you're feeling okay to have a stretch through the glute, I'd say this is your best way to stretch here, so from a seated position. Sometimes people will show you lying on your back and then pulling that knee across, particularly if you have any injury through the disc. I don't really like showing people to do those ones because when you pull your legs up towards you in a lying down position, that can cause even more stress through those posterior structures of the spine. So I prefer to keep you nice and neutral and seated for these stretches, just to start with, until that kind of pain and that sharpness settles down. All right, so from here, we're going to sit up nice and tall. We're going to bring one ankle, usually of the side that you're stretching, but let's stretch both sides because you'll notice different areas of tightness from side to side. So bring that ankle across to the knee. Now, this may be enough of a stretch, enough of a struggle for you. You may even want to lower that bottom leg down. This may be enough of a stretch. You might feel it straight into that hip there, okay? So I'm going to start from here and say that if you're from this position and you're not too stressed out there, sitting up nice and tall, keep that spine neutral. We're trying to stretch the hip, not the lower back here. So from there, if you have the range available, we're going to drop that knee, okay, into external rotation through the hip, abduction through the hip. That will bring on that stretch a little bit more, okay, in that glute area. Now from here, with my bottom heel, keeping my back upright, lift that heel off, okay? That's bringing the thigh bone towards you a little bit. It's putting the hip into a bit of deeper flexion. And you should feel that increase a little bit if you are particularly tight through there. If you're really flexy and mobile, you may still not be quite feeling anything here. And that's why when people get on the ground, they're sort of pulling their legs towards them, really tucking them into their chest. I'll give you some recommendations on those stretches as well if there's something that you're doing that you do find helpful. I just want to give you a couple of safety tips through that lower back there. Okay, now from here, if you still need a little bit more stretch, again, I just want you to feel from the pelvis like you roll forwards a little bit and stick your tailbone out behind you. So it's an anterior, a forward tilt of that pelvis. So now you're sticking your bottom out behind you, keeping the legs exactly where they are, slightly increasing that little extension curve through the spine. Now I'm getting a good stretch through there. Some of you may still need a little bit more through here. So from here, again, spine nice and tall. And keeping that heel off, you're just going to go for a little lean forwards, but not round spine forwards, because that's just going to stress those posterior structures of that lower back. You're coming in from the hip joint. Spine stays in the same position. Great. And holding there. Now, so many people, you know, whether it's yoga or gym or, you know, even like high school PE, when they've told you to stretch hamstrings, glutes, they've always shown people to fold forwards, really bend forwards into the stretch. Now, glute muscles and hamstring muscles. Glute muscles attach all around this area. They don't attach into the lower back. Same with hamstrings. Hamstrings attach to the very bottom of your sit bone, bottom of your pelvis. No attachment up higher into the lower back. So adding that flexion, it adds more weight into your stretch. So that's why often you do feel that increase. But adding that flexion, it stresses your nerves a lot more. So there's just a safer way of doing it by adjusting through the pelvis and keeping your spine neutral, and you'll find you get a much more specific stretch. So the stretch here is coming just through my hip. I'm not getting anything through the lower back at all. All right, so we probably held that for a while there, long enough. So again, with your stretches, just thinking 60 seconds. Nothing major. Little rock side to side can just get a little feel if there's any other areas that are a bit bound. Just give you that sensation of changing the angle of the muscle fibers that you're stretching. Only if that feels nice. If it doesn't feel nice, just the static hold is fine. And so we want to sit up, drop the heel, uncross the leg. Now you'll repeat that on the other side just to feel the difference, and it's good also to compare what we call a pathological side or the painful side to your non-painful side, but I don't like using good and bad. We don't like labeling parts of the body good or bad, because the brain and body creates mirror neurons. So if we have better strength, better mobility, better coordination, by trying to do both sides, our brain can then try and create those mirror neurons and then teach the less able or more painful or less mobile side to mirror our better or more functional side, less pathological side. Okay, so from here I'm going to move that chair. I'm just going to finish off by showing you that glute stretch lying down. So, because I know a lot of people get shown this either in clinic or in Pilates, yoga, gym. So it's that cross of the knee over and rotate out. Now, if you grab the legs to pull towards you, I want you to think of grabbing around the thigh, around the hamstring, rather than over the knee, purely because we just don't want to squash that knee into flexion there. So just grabbing around the back of the knee. And then from there, so I've flattened my spine completely into the mat here now. And what I'm going to do is just roll back towards my tailbone, lengthening my spine along the mat, creating that space under my lower back. And by doing so, that's increasing the stretch in my hips so much more than when I'm pulling here. And when I'm pulling here, there's so much pressure going through those posterior structures of the spine, which may further be impacting on that sciatic nerve. So we want to try and keep the spine neutral, lengthen out, keep the tailbone heavy, and keep the legs where they are. So that's just your tip there to correctly and more ergonomically do that stretch if you do prefer to do it lying down. Seated, I still think, is a little bit safer if you're feeling very sore and getting a lot of pain and symptoms. But if those ranges are a little bit more available to you lying down, that's just a bit of a safer way of stretching through there. And that's about all we'll cover for today. So let me know how you go with all of that. And if you have any questions or concerns, any comments, feedback, please just let me know. I'm going to be doing a few more injury specific videos like this over the coming weeks. So even if you have any special requests of things you might want to cover, whether it's shoulder rehab, tightness in the neck, something to do with the knee, we can go through just some basic exercises for any common conditions that you might want to go through. So thank you so much for your time, and yeah, if there's anything concerning coming up, any shaft pain, any significant weakness, significant loss of sensation, bowel or bladder dysfunction, then always, you don't want to be mucking around with that. Always seek some actual medical assistance. Okay, thank you very much.